Um, this video is clean dry dressing and the sterile dressing changes. First things we do first is we verify our physician's order and we make sure we have the correct patient in the correct wound. Okay, I'm gonna turn this down so you can see what I'm doing here. I'm gonna use the table as my wound, a spot in the table that is my wound right here. Let's see. I have a marker. I'll draw one. That'll make it easier so you know exactly where I'm going. So this is my wound. That spot. Okay, first after I knock on the door and introduce myself to the patient and verify that the patient is correct, I'm going to perform hand hygiene. I'm going to don gloves. I will have all my supplies with me, and I will remove the old dressing and dispose of it in the biohazard bin. Once I do that, I will remove those gloves and perform hand hygiene again and put on a pair of new clean gloves. Once I've done that, I will take my saline and I will place it on gauze. And I will clean from the outside to the inner using a separate gauze to get in, all the way to the inner. Then I will use dry gauze to dry the wound from the outside to the inner, using one pass for each turn. And then once I do that, I will open my dry dressing. This is a regular dry dressing and it has a gauze on it on the inside. I will open the edges without touching it on the inside. Place it over my wound. Make sure my edges are down. And once that is done, I'll make sure it's secured. If I have to secure it with tape, I'll do that. And then I will remove my gloves, perform hand hygiene. I will document on the wound the date and time and my initials so that next shift will know that I did it on my shift. Then I will document in the residence chart that was tolerated well. I will document if there was any drainage or any excess drainage or anything, or if it's getting bigger or smaller, or if it needs to be looked at by the doctor. And then that's my clean dry dressing.